Good evening, everyone. A wonderful evening to us all over the world. I want to welcome you to March series organized from the parenting support community put together by Faith Ministry. It's a time for us to learn again. It's a time for us to gain knowledge. It's a time for us to add value as parents to be, as child caregivers, and as many persons who are in charge or in the business of raising children. And we started this series yesterday, and today we're going to be making progress. We're going to be making progress, and we're going to be having another very powerful session that we're sure all participants would gain maximally from. This evening, we are going to be hosting another of our guest speakers. And yes, I've tasted something like this, and I'm sure that it's going to be another great time here tonight. I'll very quickly introduce him and speak about the event that we are attending tonight. My series is put in place for us to cater for knowledge, and by God's mercy, we're going to be having facilitators. Yesterday we had Dr. Olaseyide speaking with us, and this evening we're going to be hosting Dr. Ojedeji. I can boldly tell you that if you're a parent, you're in for something great, because I'm quite sure you're going to be learning a lot beyond antenatal. On that session, because many parents in there
mic is muted. Your mic is muted.
Hello, can everyone hear me now?
Yes, Mr. Samuel, we can hear you now.
Oh, I'm so sorry. I think I just noticed that I've not been heard all the while. Okay, I'll briefly go over what I was meant to say to us. This event is Match Series, and we are doing this so that we can add knowledge as parents to be child caregivers, and we can become better at parenting. It's really very important because knowledge is very critical. And we seem to be giving much focus to children, particularly at the early years, because it's a very critical stage that matters in development. And if we miss out on that, in that phase, we might have a lot to do. And actually, going remedial is not the best. Yesterday, we had Dr. Lasseinde speaking to us about critical periods in our children's development, implications for parenting. And today, we're privileged to have in this room this evening, Dr. Emmanuel Ojedeji. Dr. Emmanuel Ojedeji is a dentist by profession. He has worked with different health institutions. Presently, he is the head of department for the dental clinic at the Bowen University Teaching Hospital, Gomosho, as well is the health coordinator for the Red Cross in Oyo State. I'm sure we would get a lot from this presentation as I've tasted it before. So without taking our time for that, please join me to welcome Dr. Emmanuel Ojedeji for his session tonight. You can share your screen with us, sir.
Mr. Samuel, can you please help me with the screen? I was unable to input that. So please, I will be communicating with you when it's time for the next slide.
Okay, well, I can do that. But you have the you can actually share your screen now if you want to anyway. But I can bring in your PDF anyway. Let me just bring it in so that we save time. All right. I think everyone should be able to see the screen now.
Okay, thank you very much. That's clear enough. Good evening, everyone, and I want to say a big thank you to the facilitator and everyone participating. This will be quite brief, but I want to tell you that you will enjoy it as parents to be, parents, guardians, and those that even they are in care of children, whichever way they is. I believe this is something that we all need to attend and pay attention to. The match series, so I'll be considering, let me just go straight to the presentation. We're considering better care of babies and children from 0 to 15. Please, can you hear me, Mr. Samuel? Can everybody hear me, please?
Yes, please.
All right, thank you. So we're considering that I want to say I'm Ojedeji Emmanuel. Can I have the next slide, please? Next slide, please. Now, what we'll be doing primarily, we'll be considering this under this introduction. It is important if they are considering children. I want us to lay this foundation even as before pregnancy, before these children are being given back to, during pregnancy, and from different ages The last thing there has given us a very robust introduction to these ages of children and education to parents. We are considering the dental aspect of these children from different ages. So of importance to us is even before the conception of the children and during the pregnancy itself, and the ages down till um, till they are entering the adulthood. So can I have the next slide, please? So while we are preparing that, it is important for us to know that a way of introduction that children, as we know that they are the heritage of God. And if I will just read like two or three Bible passages. I love proverb. But before proverb, let's read Psalm 8, verse 2 in the TPT version. It says, "You have built a stronghold by the songs of children. Strength rises up with a chorus of infants." This kind of praise has power to shut Satan's mouth. Childlike worship will silence the madness of those who oppose you. You can see that even God understands so well the sense of children and the power of children. And we can see here that the songs of children is very important, even the amount. And sound production is very important. I'm sure that we have speech therapies and some other people, but to produce sound, articulate sound, to articulate things together, the aura, the mouth is what produces it eventually, bring it out. And the teeth is important, the lips important, the tongue important. You can imagine if you have wound in your mouth, how it will be very difficult to eat, to talk, and to relate with people. So this is very important, and we need to consider this with children. And one of my passages is Proverbs 25, verse 19. And it says in the NLT version that putting confidence in an unreliable person in times of trouble is like chewing with a broken tooth or crawling on a lame foot. We can see here that a broken tooth is likely to putting confidence in unreliable person, putting confidence in someone that one can trust. So having a bad tooth or having a broken tooth is something very terrible that shouldn't happen to anyone. And if it happens, to take care of it. So what can we do to prevent all of these things? And we are so sure we all know these Bible passages before. We should be in good health and all of this. And even God in Genesis chapter 49 verse 12, was saying his eyes are darker than wine and his teeth are whiter than milk. We can see some of these scriptures just impacting. Can I have the next slide? And even Job 29 was talking about the mouth of children and so on. So let's move very fast. So before pregnancy, studies have shown that that good oral hygiene does not only make you to be kissable. I mean, this is parenting adult environment, I believe. So if a child is listening, maybe just to add knowledge, but this part I'll be mild about it. So good oral hygiene does not only make you kissable, of course. Let me just gloss. It also makes you to be more fertile. I'm sure some people are hearing that for the first time, but you know that even when you have good oral hygiene and you are kissable, has been on ground, is showing us that dental health may impact how long it takes a man to conceive. That's very, very funny, right? Yes, that dental health says
All right. I think our guest speaker has some network each from his end. Let's just please keep some minutes behind so that he's able to connect back to us. So sorry about this. You're welcome back, Dr.
Hello, Mr. Can you hear me now?
Yes, we
all
can
right,
hear you.
thank you. Sorry about that. All right, apologies, please. So as I've established before that good oral hygiene makes someone to be more stable and fertile, and equally it has been established that researches of late shows that it makes someone to be the next slide, please. The next slide, please. And even in Caucasian, yes, now we are there. So in non-Caucasian, the non-Caucasian women appear to be the group that's related with this study, and they said they are likely to take more than 12 months to become pregnant if they have gum disease. Can you just imagine that? And you think only women that this is affecting? No. Studies have shown that in men, gum disease and tooth decay have been linked to poor semen and sperm health. So, ladies and gentlemen, I will say at this point that even before pregnancy, as we are parents to be, let me use what parents to be. As we are parents to be, and even as a parent and expecting children, wanting more children, we should put all of this in mind and to encourage ourselves in good oral health. Next slide, please. So, moving to the pregnancy stage. During the pregnancy, studies have equally shown. I'm trying to let us see that we are not just talking here. We want to see what has been established, that bad oral health in pregnancy. That due to bad oral health in pregnancy, pregnant women can experience premature delivery. Wow, really? Yes. Low birth weight of baby, preeclampsia, gingival tissue ulceration, pregnancy granuloma, gingivitis, pregnancy tumor, loose teeth, mouth dryness, and dental erosion. You can see that these are serious things that can happen during delivery. We will not lose our babies in Jesus' name. Amen. So I will say that this is very important. And not just that, during pregnancy, there are a lot of hormonal changes in women. Oh, that is to relate, and even women too can relate. That there's a lot of hormonal changes in women, and these hormonal changes, the change in hormonal level in pregnancy, directly affects the gum and indirectly cause tooth decay. Studies have established that. And one thing I want us to know about some medication, you know that in pregnancy we say, okay, first trimester, second trimester, and third trimester. All of those trimesters are very, very important. And during pregnancy, there are some drugs that we should not attempt to take. Please stick to the medication given to you by your physician, by the doctor. Please stay on those medications alone. But sometimes, maybe you just want to take something. There are some drugs you should not even take at all. Some antibiotics that has the cyclin families, the tetracycline and the doxycycline, and some other ones too. But majorly of this tetracycline and what happens is they can transmit, they can flow from the mother to the baby. Some things don't flow from mother to baby, but this drug has the ability to penetrate from mother to baby. If that is the only thing, it would have been better. But this drug has the ability to stain hard tissue in the body. What do we mean by hard tissues? The bone, the teeth, those are the hard tissues. This drug can stain it. It will turn into brownish color. But you can't see the bone. The bone is covered by flesh. Only if you open the bone, you see that those bones are already brown. But unfortunately, the teeth are the first thing you see when someone smiles. So the teeth are brown. Both the milk teeth and even the adult teeth, if this drug is taken during pregnancy, for the baby, the milk teeth and the adult teeth will be discolored. Even if these drugs, we don't give it to children that are within this age bracket that we're considering, because during that same age, the permanent teeth, which is the adult teeth, is still developing. So if you give children from a 0 to about 6 thereabout these medications too, what it will happen is the permanent teeth that is developing inside the bone will pick up the medication and becomes brownish color too. So we don't want to give this medication to children and even during pregnancy. Next slide, please. So as we have that, and after pregnancy, that we have given birth to a baby now. So Simon, can I have my last slide, please? Yes, now the babies are here. Glory, glory. Somebody rejoice. Now we have our baby. Now, in this part of the world, they are still developing, I know, right? So number one thing I want us to do, pay attention to, I'll be mentioning those things specifically because of our time. Now the baby is there and there's light. Come on, let there be light. Everybody is rejoicing and the families are rejoicing. Everybody, they're coming from far and near. And wow, all of a sudden they saw something in the baby's mouth. And that's been seeing a tooth in the baby's mouth. We call it natal tooth. Natal tooth. That means when a child is given birth to, the child comes with a tooth in the mouth. There's teeth or tooth present in the baby's mouth. Similar to it is neonatal. Neonatal means between the day 1 to about day 28 to day 28, there's now eruption. There's presence of teeth or tooth in the baby's mouth. So that's just the difference. So now there's teeth in the baby's mouth. Mothers are worried, parents are worried, everybody, they're agitating and the like. I want to tell you that there's nothing wrong with that baby. Yes, take it from me. There's nothing wrong with that baby. It's just a deviation from normal or an early operation of the tooth them and the like. Usually body with a lot of stuff. So that I want to beg the fathers to please take charge in this case. If you can protect your wife, protect your child, that tooth should be maintained. Because sometimes if you remove the tooth, there might not be another milk tooth that will replace it, not until when the child will have a permanent tooth, a first of its kind, maybe as a permanent tooth. But we want to preserve it as much as we can. In as much as one, it is not traumatizing the baby, it's not injuring the baby or injuring the mother, maybe where the baby is breastfeeding, it's not injuring the mother's nipple. If all of those are not there, there's no need for us to remove the tooth. But if the parents, the father or the mother cannot protect the child, or the father cannot protect the mother, who advise the removal, but then a removal is not the best thing for us to do. The third one I will talk about is the first tooth. In this environment again, we see a child that gives birth that comes out to the first tooth first, upper tooth, first upper tooth. That a child should come with a lower tooth first. Now the child is coming with upper tooth. That such a child, anything they say, their this, their that, worshiping them, their idols. Yeah, I will even say that if your child is coming up with a first tooth, upper tooth, you train that child love. Not anything the child says, the child becomes a prophet of the house and saying the good things in the house. Is that not a good thing? That's better. But that's very difficult if a child is bringing out the upper tooth first. So it's not something we should worry about. It's just that the upper tooth is coming earlier than the lower one. Normally, the lower one should come first. But if the upper one is coming first, it can come earlier. And there are some children that are even early erupters. These days, we're expecting that the child will erupt maybe at 6 months. Some erupt faster, 4 months, 5 months. So it can be the upper one that will come first. And number 4 now is people are asking, why clean my child's gum and like, yes, mother, it is good to keep your child's oral health clean, the mouth, keep your child's oral health healthy, clean their gum, clean the tongue as much as you can, not forcing it. Just gently, there are gum cleanser in the market that you can buy. Just to rub the gum. It's not after milk, or this sedimentation of deposited milk on their gum and all of those, so you can help them to wipe it off. Again, people have had pacifier, advice leave it there. It's good to give baby pacifier, but these days they are advising that not the one that has sugar containing as it well, that you will reduce substrate of sugar into the baby's mouth. Probably we'll get to that later. But if you want to give pacifier, there's nothing bad in it. Some people have even added more some different sorts of sweetening or different sorts of to the pacifier to make the baby to want to take it. And breastfeeding, wow, you know, it has been said that breastfeeding is exclusive 6 months. There was a time where doing some series of relating breastfeeding and development in children, dental development in children, and it saw also like found out that children that are well breastfed were not just developmental in reasoning, their oral health is always perfect. And I will link that breastfeeding to teething. How do I mean? When I say life is perfect, not that they cannot have the alignment of teeth. I'm just talking in relation with immunity, good oral health, that their teeth develop well, and all of those. But let's relate the breastfeeding to teething. Now, a child that is well breastfed is supposed to have good immune system. You know, people have turned teaching to Yoruba will call it Osheyin or Mosheyin. Teaching, someone is raising your hand. Can I continue, please? So,
Yes, sir.
teaching.
Yes, sir. I was one who raised hand.
All right.
I think there's a kind of break in your voice. So I was thinking probably you should take your video off for now, sir, and see if the audio will be seamless.
Okay.
Sorry, we are so sorry about that. I think
Okay.
it's
The video is off now. All right. So, can I continue from where I stopped, or we should go back a little?
You can maybe just
Hello, Mr. Samuel.
you can just backward a little.
All right. So, just on this same from age 0 to 6, we talked about what that when they are coming now, they are around. They are coming with teeth. It's possible, and it's not a crime, and it's not that the child is bad. It's not a bad child. It's not a banji. It's not it's not such a thing. So, if a child comes with tooth or teeth while they are giving birth to, or a child has an upper tooth first, it's not that the child is a bad child. No. So I would say that you can clean their gum for them, give them pacifiers if you want to, but you don't encourage it as often as you don't want to encourage pacifiers for children. But if you want to give them pacifiers, at least don't give them the one that contains sugar containing pacifiers. There are different ones in market. Check very well and be sure that you're not giving them a sugar containing one, not to introduce um, uh, substrates of decay into their mouth. And I was relating breastfeeding and teething. You know, people have attributed teething to uh, uh, that is when the gum is coming, when the tooth is coming out, the child will fall sick, the child will run temperature, the child will be pooping, will be defecating, and will be having a running stool and the likes. I want to say that that is not actually true. Dr. Lasinde mentioned that to us yesterday, I believe, and during the age at which we are talking about it, age 6. One, this is a 6 month, I suppose. I meant to say these children are already crawling, and this is the time in which they will put in different things in their mouth. And if their immune system is not well built through breastfeeding, because that's the first means of immune system that a child will gain through their good breastfeeding, the immune system will be down, and the child is susceptible to having infection. So all those teething, the temperature and the like. But it's so unfortunate, it's so fortunate or fortunate, so to say, that the same timing is when the first set of teeth will be coming up. So you can't afford not to give your child good immune system by breastfeeding them well. Good breastfeeding at this from the beginning till this time. That's why we encourage exclusive breastfeeding for the first 6 months, so that the immune system will be superb. And that will encourage the teeth to come out seemingly and not be having temperature, immune system running down, and all of those symptoms that comes along with the query teething. And I've mentioned medication the other time. There's some medication that you should not even bother to. So please stick to the medication given to you in the hospital. I understand the fact that sometimes a child can be so sick that what everybody is after is to keep the child alive, and everybody is bombarding with antibiotics and life. There are some that we don't want to even use at all, as much as we can. So please stick to the medication prescribed to you by the doctor. Do not do self medication. Ladies and gentlemen, please do not do self medication. And the next one is first to showing. Wow. By the time the first tooth is showing, everybody is happy, everybody is, the child is calling. That's not the end. That's not, next slide, Mr. Samuel, please. That's not the end. And that is when to start introducing the child to good oral health by themselves. Try to put them into some nice oral hygiene. I think we should take a little cup of coffee. Let's relax, take a deep breath while enjoy your coffee. I think this is a very beautiful one, Mr. Samuel, for the night. Next slide, please, because of time. Next slide. And now we are at age 6 months to 2 years. Now, this phase is very crucial. Why will I say that? This is the time in which the teeth, the milk teeth, will be. So between age 6 months to age 2 years, it's preferred that the milk teeth will be the one that will sustain them. So we don't want anything that will tamper with our teeth. We want our milk teeth to be preserved, to be okay, to stand good for us. So our milk teeth now, that's our formation. Let me use the word formation. That's formation 442 for those that are sports oriented football. What do I mean by 442? They will have four incisors, two on the right, two on the left, and two canine, one on the right, one on the left, and four molars, two on the right and two on the left. So at this time, we can start to introduce our children how to clean their teeth. There are different kind of brushes in town. Please stick to age appropriate toothbrush and age appropriate toothpaste. There are toothpaste that are for ages of this kind of ages, even from 2 to 3 to 6. There's other toothpaste for them. It's because of the content of the fluoride in those toothpaste. And when our children have they don't spit it out. All they know is everything in their mouth, they take it in. So we don't want them to ingest so much fluoride. So there are age appropriate toothpaste for them. Even there are toothbrushes. There are different shapes and different forms of toothbrush now. The one that you can waggle, just beautiful ones that will make them to want to always brush. So get those for them. So toothbrushing is very important from age 6 months, of course. The teeth is just coming out, so you can just be doing that for them. But by the time the set of teeth is complete, from 2 to 6 months to 2 years, that's when the teeth will be coming out little by little, little by little. One, the incisor first. Let me not. I think I've already jumped to my next slide from this by saying that the milk teeth is for this age. No, this is when the milk teeth will actually grow. So please pardon me on that. This age from 18 months to 2 years is when the milk teeth grows. So we want to introduce it slightly. They are talking about toothpaste, candy, fruit. We appreciate if you can give us fruit. But things are changing these days. We are no longer paying so much attention on what people eat as it were, food as it were. But and the next what we are clamoring for is what they do after they've taken those sugary substances. But we'll still talk about it in some other slides ahead of us. So and then when they have dental caries, if we give candy, we'll be prone to having caries. And we don't want that for the set of teeth, for our teeth, for the children's teeth. So we don't want that to happen. Now, people have asked a number of times, this toothpaste, does it have fluoride? Which one do I use? One that does not have fluoride. I have one toothpaste they gave me from one place. Is Abba, is this, is that. Ladies and gentlemen, I will gladly say that any paste you want to use for your child, let it be a fluoride containing toothpaste. Fluoride has its own uh, function, and we cannot underplay fluoride in the composition of teeth at all, because it makes the teeth stronger. It makes the teeth to be resistant to dental caries and some other things that fluoride help. Even we call it makes the environment of the teeth, the mouth, unconducive for the bacteria to work, the germs to work on the teeth and spoil them. So we want a fluoride containing toothpaste for our children. And another one that everybody wants to always talk about is tongue tied. My child cannot talk well. The tongue, I feel the tongue is under, it's not lifting. Yeah, it's possible that the tongue can be tied, that the child tongue will not be moving as it should be. If you notice that, please visit the dentist, let them see. And if truly your child has a tongue tie, they can relieve it. Just do a little minor surgery so that the tongue can be free and the child can talk well. There was something that happened to a young man. He came to the hospital 17 years old boy, and he's having tongue tie. I can imagine how that guy has been talking for the past 17 years. I has been relating for 17 years. So if you notice that, please, tongue is very important in phonation. So we encourage that when you notice any of such, please report to the hospital and let the dentist evaluate, and they can work on that. And that takes me to our transition I said the other time, which is our 442. So we are leaving the 442 now. We are transiting fully into the 442. So next slide, Mr. Samuel, please. So we are in age 2 to 6. So we are carrying our 442 into our age 2 to 6. So that's where we'll be using the 442 system now. And I've talked about, you can see the chart about the number of teeth I mentioned the other time, the age of eruption, and the age at which those teeth will be shedding, that will shed off. Of importance to us, why those ages are very important, is because you have an idea when the teeth will grow and when the teeth will fall off, and you can prepare. And if you notice that the teeth is not falling off early enough, so sometimes you need to pay attention to these dates so that you can present to the hospital. Some children will have retained milk teeth at adulthood, and that will make them to have malalignment of teeth. So we'll say that by the time you're watching this and those teeth are reaching the time of falling off, please pay attention and bring us to the hospital. We really appreciate that you bring us to the hospital so that we can, to the dentist, so that we can assess our teeth and attend to us in good time. It says in time, says 9. So a teach in time says 9. Thank you. So we need to continue at this age. We'll continue our 442. I'm not done, Mr. Simon. Can we go back, please? Can you go back? Yes. At the same 442, we need to continue taking care of the milk teeth. And, we said learning starts from home. This age, these children learn by what they see. They learn by observation. And this is the age at which phonation starts. They start communicating, talking. Please, that is a mommy's caregiver. Please, if you want us to brush twice daily or at night, please, you too, brush twice in a day. And we encourage you that whatever you do that is right, let us see it and we do it. These children learn from home. So all of these things we're talking about, let's show them and let them start doing it. And at this age, at least let your child visit a dentist at this age, within 2 to 6, just for checkup, for visit. There are some things in which the dentist will see that they will tell you, let's plan to avert some other things in future. For example, a child that has very tight milk teeth, that child is likely going to have crowding. The arrangement of the permanent teeth will be haphazard because the permanent teeth will be bigger than the milk teeth. Now, the milk teeth are very tight. They are standing side by side. So there's no space enough for the permanent teeth. But if your child has seen a dentist at this age, they can, one, introduce such child to oral health in the hospital, and they can equally let the child have an idea. It lets you know if there's possibility of any issue. Next slide, Mr. Samuel, please, because of our time. Can we move faster now? So we can take this for dinner. It's a very good one. Anyone you feel like having, that would be nice. But I think there's some people telling us to be eating every food again at night. Next slide is Mr. Samuel. Which one do you like, Mr. Samuel? Enjoy it. All right. So at this age now, of importance to us is from stage 6, we know that we'll be jumping from one place to another, and we'll be running very active. You see them in school, even at home. At home, that's the last thing they told us, that this age, there are some things we should not put, not slippery places in the house so that people could fall, remove obstacles and the like. Please, we will continue care from the milk teeth. You don't forget that at this age, you said that the teeth will start falling off, they start shedding. So they will telling you, mommy, this thing is paining me, I cannot eat very well. Is that not the time that you say, go and eat your food like that? Go and do this. No, please pay attention to us, because it can actually affect their work in school. They might not concentrate well in school. Even when they are working, they are teaching them, they might not imbibe all of those things. So it's important that you pay attention to a child or else. It can make them to fall sick and they're not able to go to school. And you don't want that's for your child. I mentioned malocclusion. I mean malalignment of teeth. So that this age we start seeing it because the permanent teeth will start coming in, and we can quickly note that. So if you notice something of such, that the permanent teeth is already growing and the mixed tooth is not falling off, please visit the dentist. Let them do the needful for you. You don't need to. It's not big deal. We are lovely people, and we enjoy seeing you. And one thing in this age group that I want to pay attention to is trauma. We fall a lot, run, fall, stand up by ourselves again, fall again, and all of those things. And we tend to, and when we fall face forward, and we might eat our teeth on anything. Now, in this kind of environment, when things happen this way, people tend to quickly beat the child, blame the child. Why will you do that? No, please, let's take care of those children. Now, when there's trauma to this, maybe fight, blow, or anything, or whatever it is to the teeth, please present to the hospital immediately. Sometimes the teeth can fall off completely. We call it abortion. The tooth remove everything, remove completely. That is not the time to be fidgeting or to throw things away. If you can get those teeth, please bring it to the hospital. Are we together? Please, let's bring it to the hospital. The dentist will know what to do when they see. Fine, there are some instances in which the tooth is not fully developed, that the root at the end is not closed and like all of those ones. But peradventure there's any form of trauma, ladies and gentlemen, I will encourage you to go to the hospital immediately. Don't delay. Albeit there are some medium or medial that we can preserve teeth if they fall off. There is some are in market. I'll just mention a few. The standard one is what we call angst banner solution. You can get that in a stock solution. You can just drop the tooth inside the solution, preserve it, and quickly come to the hospital immediately to make the tooth that the teeth can see viable. You just hold the tooth at the crown, the head of the tooth, and just drop it in there. And if you don't see that, you can get a pasteurized milk that can easily be gotten. And if you don't even get anything at all, um, just get a wet maybe clothes and put the tooth and bring it. That's the least thing you can do. And come to the hospital immediately. The dentist will know what to do. So at this age, it will require a regular visit to the hospital. And why will that be? So that you can monitor your child's oral health at Tama. At least, if you can't do anything for them, prepare them when it's their birthday, maybe a week to their birthday, they go to the dentist, have a nice time with the dentist, even if you just cleaning their teeth for them. That's something. If I can't say go to university for parents should be like that. But their own birthday at least it should be twice in a year. But if you cannot even do twice in a year, target their birthdays and like children it's time or maybe birthday and Christmas, something like that to make it twice in a year. So to just go to the dentist and let them have their mouth checked. And when we see those things early enough, we can quickly address them. When you come to the dentist in time, there are things we can quickly do. But by the time you start having pain, the if the list of what to do, more than half is already off. Half of the if by the time you start having toothache, tooth pain, more than half of what we can do is gone if it is all on the tooth anyway. But if you come early, only when food enters or when I face shopping suggestions, those things. But children will not tell you with time. So that's why you should bring them. Let the dentist examine their mouth, and we can next time, Mr. Samuel, and we can be able to leave those things to the board. So summarily, I will say that for our children and for us adults also, children they were addressing now they've transited from age 0 to age 8 and they are now going to adulthood. It is important to feed on right kind of food, right kind of food. Very, very important. I said before that we no longer pay um, preach the gospel of food anymore because these days since paradigm is changing. That even whatever you take, chocolate, candy, whatever, if you brush when you are supposed to brush, you brush regularly, you do all of those things. How be it in this part of the world, we even when we say brush after meal, some people say brush before meal. The shift things are changing. Some countries, some Caucasians, let me say the whites that take tea often in the morning or where what have you. They encourage that they brush before because after they've taken the tea now, the teeth is already soft due to the acidic content of the tea and the like. And if they now brush after, it can wear off the content of the teeth. But yeah, whichever way it is, I would advise that you eat the right kind of food. And because that food substance is what the bacteria, the germs in the mouth, we use to produce what will destroy the teeth. And another thing important here is plaque. If you notice that if you scratch the surfaces of your teeth, even after you have brushed, shortly after, or even before, you see something whitish, those are plaque. And when those plaques get hardened up, they turn towards calculus, the tartar, very hard. On this, we encourage that you remove the plaque regularly. Why? The plaque serve as sponge that will mop a little of the food substance that you have introduced. Not just that, the plaque attaches itself so well to the teeth, the surface of the teeth, and inside the teeth, inside the plaque, under the plaque, or inside the plaque, the bacteria, which are the germs, they attach themselves to the same plaque. So you have three factors already established. And the next thing is if you don't remove those plaques and remove all of those things, the teeth they start producing what will destroy the teeth and destruction setting. So 3 R's that you should not forget: right kind of food, remove plaque, and regular visit to the dental center. Regular dental visit is very important. So I'm using this medium to ask you again: have you had a dental visit this year? If not, schedule one before the end of maybe June. So before the end of the year again, you have another one. Just walk in, let them examine you, and it's fine that way. So it's very important to note these 3 R's. Next slide, Mr. Samuel, please. As we are rounding up already, because it's been a long time, a little while, and for these children, I believe it has been so educative. So this March series, if there's any question to receive to ask, we would like to answer them. Next slide, Mr. Samuel. Thank you very much. I really appreciate the opportunity and the time. And I believe that we've had a good time, a good evening too. Thank you.
Thank you so much, Dr. Emmanuel Ojedeji. We are very grateful to have you join us. It's been so exciting, so educative, and we are learning. I'm learning, and I'm sure each and every one of us we are all learning. We would need to take questions. So if there's anyone who has any question, please, you would do well to probably flag your hand. Let's see, so that I can take your questions. Any concern? You have a child and there seems to be some dental concerns. please, it's time to flag your hand. Let's see if you have any question. Also from the YouTube, the person monitoring the YouTube on our behalf, please, if there's any question there, kindly send it across so that we can treat it. Meanwhile, I want to plead with us, please, on the YouTube channel, kindly subscribe to the channel, like, make comments, and then please share the video with other parents and parents-to-be, child caregivers who would need this kind of session.
Mr. Samuel, sir.
So, do you have anyone with you? Yes,
Hello, Mr.
sir.
Samuel. I'm
yes,
of opinion that peradventure there are people that they have questions and maybe they are not on the platform yet. Maybe they will listen to it later. They can post their questions to those channels and it will be attended to.
All right. And for those who are going to be listening later, that's particularly the YouTube. Thank you so much for that. Presently, I don't think I've seen any hand, and I don't think I'm seeing any question coming up. Well, I think I would like to raise some concerns. First, you did mention it about eating habits. You know, eating habits. Children eat cookies, eat sweets, chew gums, and all of that. To what extent should we, as parents, cut those things off? That would be my first question.
Okay, should I answer that first?
And the second question, I believe would probably be a young people. Sir?
I'm with you.
Can I go ahead? Okay.
Yes,
on please. The issue of cheating, how can we manage grandparents and elderly people around us? Because now, for me now, what I'm just looking at that cheating is actually a myth. But to our parents, we grown-ups, to our grandparents, to many of them, cheating is not a myth. And when they say certain things and we don't seem to take it, it might be like at times maybe we don't appreciate them enough for their concerns, or it's like they are giving us advice and you know all these people they might call us Akọ̀wé, you know, apologies to those who are not Yorùbá, and you know, like Akọ̀wé, people who are learned, and you know, all because we are well informed than they are, particularly in the kind of generation we are. So how can we manage them properly? I think this question is dental related and I think family related as well. So kindly please react to those two questions for us.
All right, thank you, Mr. Samuel. Now, regarding to what extent can we cut down cookies, sweets, biscuits, chewing gum? Really, one thing you should know, and I said it initially, there are 4 major factors that contribute to diseases of the teeth, decay of teeth, and even gum disease. The decay of teeth itself, majorly 4 factors. And of those 4 factors, 2 you cannot control. That means the teeth itself, the teeth factor, the tooth factor, and the bacteria or the germ, the bacteria is raw bacteria, microorganism factor. The other 2 that you can control is what the bacteria will feed on to produce what will destroy the teeth, which is the cookies, the refined carbohydrates. Let's use that word. Refined carbohydrates, sugar containing food itself, and time that it takes before the decay occurs. Now, you equally remember that I mentioned that in some parts of the world, the emphasis is not, even now, even in our whole part of the world now, the emphasis is no longer on what we eat, what we eat anymore. The emphasis is now like, okay, fine, we said established that two factors we can control, the food and the time. So except we align to ourselves, that means the time is no longer the factor. So we are saying that if you can break the time interval, it's not likely that there will be, what I mean by time interval is brushing regularly, intercepting the process of decay. But you and I know that there are some food that when those children, normally they should lick it, but I know them, they will not lick, they will start chewing. And it sticks so well to the surfaces of their teeth. And this is a child that if the mother will not brush at night, not talk of the child brushing at night, the food will be on the surfaces of the teeth till the following morning. That means we've one, we've introduced what will cause the disease, what will cause the breakdown. So I will just advise, I won't have a side as it were. I won't have any side. I will only say that if we can substitute those sugars or cookies or those they're not kind of destructive food. Those things that can cause the decay with some other food like fruits, a number of fruits in town and some other not sugar containing as it were, but not sugar, they only like something sweet. I guess now there are other substitute of sugar itself, but we can't see tell the side effect of those things. So you can substitute those sugar things for fruits, can pack fruits inside the container for them. They go with it to school and they can eat it. Salad, fruit salad, and some other things like that. That would be a good one. But if you feel you can take care of a child so well that you have to be brushing every evening, even when they go back from school, you can monitor, check their teeth, you can leave them to eat their cookies. Even if you say you don't want to give them to eat, they will rather find a way around it with their children. That's one. And the other one is regarding how to manage our parents, grandparents precisely, in line with it, because they see it as something so serious as it, and it's a means, as you said. It does that. One, you need to understand grandparents, their concern, and they will tell you that's the way they raise you, their parents. So one, you have to be calm. All you need to do is to explain to them, make them see, table down the obvious. This. Explain those things to them. When they see what you have said and they understand well, they can reason with you. But if they don't know, my brother, they will not listen to you, and they will feel like they are not doing what is that. They will bring sort of things from you from the village or from that. This is a going, all those concussion for teaching and this and this and that. So one, let them tell them, even when it happens, they are going to the hospital. That's one way to solve that problem. How mommy, daddy, we have heard, but doctors said this. Most times they believe doctors, and again they will tell you, Dr. Dominica looking, no, just explain to them that doctors said this, and this, and this, and this, and be able to manage them well. I think with that, we'll be able to manage our grandparents well. Thank you, Mr. Samuel.
There is a question. Okay, someone had posted in the chat room. I'm going to read out the question. Please, do one clean the gum of a baby about a month old? The baby is without teeth, though. So I think the question is that a baby of a month old that is yet without teeth, of course, the gum is there. Can one clean, or do one clean the gum of the baby? That's the question, sir. Hello, sir. Do we still have you? Oh, I think we lost we lost our guest. Let's exercise some patience and let's see if we're going to have him join us back in the room. I would like to encourage every one of us, if there's anyone who has not seen Dr. Lassa in this presentation, I do encourage you that please check it out, create some time to go through it. You're going to be getting a whole lot from it. And someone made a request if it's possible to have a presentation, for that session. I have forwarded the request to her. She's going to be sending us a version of it. And then I'm going to be sharing that version in a parenting support community WhatsApp group. So if you are not in the parenting support community WhatsApp group, you can join, because that's where the platform is actually going to be shared, so that you are going to be able to gain access to it whenever the material is sent to us, so that we're going to share it. All right, we have Dr. Ojedeji back. Yes, sir. The question I was asking before you left, please, do one clean the gum of, please, do one clean the gum of a baby about a month old? The baby is with. There's another one in the chat room. Is it advisable to clean the tongue of a 6 weeks old baby? Is it advisable to clean the tongue of a 6 weeks old baby? If it is advisable, with what? What should we use to clean the tongue if it is advisable? Yes, sir, you have the floor.
All right, Mr. Samuel, thank you. I did mention during the presentation that it is true that these children do not have teeth at this time, but they are feeding also. As long as they are feeding food particles, the milk, and of course, we expect that they should be given exclusive breastfeeding. We settle down on their tongue and on the surfaces of the gum. And for that reason, we advise that not that you're scrubbing it as if you're scrubbing maybe something hard, but just gently. Their tongue cleanser and their gum wipe. There's something like a little brush for children. It's unfortunate that we don't have a video. I didn't prepare that. There, if you check online, you will see a little finger. You just put it like a cap into your own finger. It has a little brush over it, and on the side, it has like a tongue clipper on the other side. So one side can use it to just massage the tongue, the gum, and a little rub over on the tongue. And not like we are scrubbing it, please. If you know you might not be able to get that done well, maybe you leave the child alone. Just there something of such that we have in town to clean the gum, just a little massage of the gum and even the gum. That would be my response to this. Hello, Mr. Sami, are we still there?
All right. I don't know. I'm thinking if you have actually responded to both questions already. So that means we can actually clean the gum of a baby, even though the baby is 1 month old, but cleaning it, we have to be careful how we go about it and what to use. Did I recap you well?
Yes. I established that even during the presentation. We have, for babies, we have gum cleanser and tongue cleanser also. They are in market. You can try to get any of those. So, but not
All
at
right.
once.
And
But if you are not so sure of what to do, just let it be, so that you will not go and injure the baby or do something that is not supposed to be done.
so, sir, so cleaning the tongue of a 6 weeks old baby, that means do we still make use of that brush? The one made for their
You said
age? Or what do we use? Cleaning the tongue.
that was what I was trying to describe. I said there are, it comes in different forms and shapes, and we can always check online to see some of those things. But the one that I'm very comfortable with is the one, it has like a cap that is just a little cup that you put the the person helping the child, put it on a single finger, cap it into the finger, and it has a little massage on the little, like a brush like structure, very soft, that you can use to just massage the gum gently and even extend that to the tongue. Not like you are brushing, just to wipe. Sometimes if you are not, if you notice what on the gum of this children, you will see white white sedimentation of milk, breast milk over the gum and even the tongue. But not like we should be doing that like back to back. In fact, some school of thought discourage it completely. That you don't necessarily need to brush the tongue, there's no teeth there. But there's some study that supports that, okay, you can wipe the tongue, do some gum massage, and even they established that gum massage helps the child when the teeth are coming out. Remember, I would say from the 6 months now, that's when the teeth will start coming out. That tongue massage gives some soothing effect, and it equally helps them in coming out. So it looks more like a massage now, not like scrubbing.
Okay.
Thank you, Mr. Samuel.
Thank you so much.
Oh, somebody is sharing with us already.
Somebody share something with us.
Thank you. Yes, somebody is showing something on the screen. Are you the one sharing it?
One of our participants.
Yes, that's perfect. Thank you so much for that. That's what I've been trying to describe since. So this can be used to just wipe and clean the child's gum and tongue and like so.
All right.
I think I've answered those questions.
Thank you so much, Oluwatobi Akombi. We're grateful for that timely illustration. All right, let's take the last question. We have a question from the person monitoring YouTube. Let's quickly take that and then we call it an evening. Okay. There's another question on YouTube that I need to read out. Please let me say this very quickly, sir. I didn't. The person wants you to recap the place where you talked about the right toothpaste to use. That point, and what should the toothpaste contain? What should it have? Okay, sir. So please react to that. Or should I take the next question with it?
Please take the next question too.
All right. The next question, just let me get on YouTube myself for me to read it out. I think it's
so while you're getting that, maybe I should quickly respond to that. The first one. While you're waiting for getting the second question. I did say that for toothpaste for children, not just toothpaste alone, even the toothbrushes, there are age-appropriate toothpaste and age-appropriate toothbrushes. Because for those toothbrushes that is appropriate for their age, there are some toothbrush, very beautiful toothbrush, U-shaped toothbrush, like a U shape. They just bite on it and waggle it, the teeth. Just waggle the handle of the brush, and the teeth are clean. So for those age, it's you can get appropriate toothbrush. But toothpaste from age from there are toothpaste that are lesser than age 3, the ones from age 3 and above, and 6 and above, between age 3 and 6, 6 and above, and the likes. The reason for age appropriate toothpaste is because of the content of the fluoride. A toothpaste for a child or for anyone should be a fluoride containing toothpaste. And the reason for that, I said in the presentation, that fluoride helps to keep the tooth strong, prevent it from decay, and equally make the environment unconducive for the bacteria to work. So, and some other ones. So the fluoride is very important inside the toothpaste. Very, very important. As of today, the study have established again and again that fluoride containing toothpaste are what should be used to clean to what should be used because of the fluoride. So, but then we know children most times do not know spit out. They will not answer you. Everything, they swallow it, they take it in. So when you put the toothpaste for an adult that has an higher amount, increased amount of fluoride in it, the child tends to swallow everything. In fact, they will lick it, take everything in. And doing that, you are introducing more fluoride into their system, and it can cause fluoride to be more in the system. Fluorosis is what we call it. So of fluoride toxicity, there can be toxicity of fluoride also. So it can cause that. And there's some water that even contain fluoride. So let's go to that. But then for those children, we have toothpaste that has a specific amount of fluoride that is for their age group after study has been done. So we encourage that use age appropriate toothpaste and age appropriate toothbrush. Thank you.
All right, let's take the question from the YouTube. That should probably be our last question before we would wrap it up for today. The question is this, sir. I have a 2-year-plus baby that doesn't like
water. I lost you there, Mr. Samuel. Mr. Samuel, can you please come over it again? I lost that. To brush is not just ready to brush. Mr. Samuel, can you yes, please.
I have a 2-year-plus baby that doesn't like to brush. To brush every day is like fighting war. He's not just ready to brush. Please, how can we make our brushing to be fun?
All right. Mr. Toby, can you please help me again? There is a picture of a U-shaped toothbrush with fanciful handle. Is Mr. Toby still online?
We should be able to get that.
Yes, Mr. Toby, please, you should be able to get that. There's a fanciful toothbrush that has a U-shape and handle. I have that in the office. I probably should have added that to the slide also. So apologies. Let's get a picture of that. You can make the brushing fun. Let them do it by themselves, but with beautiful toothbrushes. Not just that, get electric toothbrush that is vibrating. You don't need to be rolling the brush down in. Then you just put it, the thing will be doing the vibrating itself. Put battery in there and you just put the brush, you just have them pull it in, out, and the thing is already vibrating to clean the teeth by itself. So we can get those fanciful tooth brushes, and you can give we can give what we call reinforcement. The brush at this time I will do this, the brush I will do that. Okay. Oh wow, thank you, Mr. Toby. That's a very beautiful one. You can see that one for the lower one is for maybe age 0 to age 3 or 2, if I'm not mistaken, or sorry, 0 to age 4 or thereabouts, if I'm not mistaken. Okay, sorry, it's already there. 2 to 6 and 6 to 12. Yes, age 2 to 6 and age 6 to 12. So we can get this kind of brushes for our children. paste to just be on it, they bite on it all together, and they waggle the handle of the brush. That's all. And all the teeth, in no time, they are done brushing. So it's very a beautiful one to do. So we can make brushing fun using this for them. Thank you. And some other ones, there are some other ones in town. The one with electric brush and some other types. So we can do those ones. Thank you, Mr. Toby. Really do appreciate.
All right.
So
I
Mr.
think
Sam,
you
we have
have,
answered that, right?
yes, I think you have answered that question. Uh, I'm going to like to make an addition. Please permit me to. Okay.
And even the addition, one other thing you can do is do as I do, not do as I say. So if you want your child to brush, let them brush when you're brushing. So you can make it fun, like that is brushing, mom is brushing, or child is brushing, or something like that, which I believe is beautiful. Thank you, Mr. Samuel.
Thank you so much, sir. I think that's just a very great one. Let's make brushing exciting. Like, let's make it fun. If you make it fun, we do it like we are enjoying it. You know, when you do something and you enjoy it, the way you do it is not like you are not frowning, you are not. Since you know that's something you want to correct, you want to do it like it's fun. And then I also want to suggest that you can make use of songs. If you are helping the child to learn brushing, you can sing certain songs that you think the child will like, or that you think the child likes, to accompany the brushing. That's also very interesting. And you can as well brush alongside. Also, I want to suggest that you put an exciting activity after brushing. This is psychological. If a child knows that after brushing, there's something very interesting coming up, you have organized and structured the child's activity that way. And the child knows that when I'm done brushing, I'm going to do something I like. The child knows that if he does not brush or she does not brush, she will not likely have the opportunity to take the activity. So the child would want to brush. In fact, we will struggle less. But if there's nothing exciting about brushing, there's nothing exciting coming up after brushing, we may be struggling really. So let's make it exciting. And really, we just need to make it exciting. Talking to very younger children, I don't like it talking to them. You must enjoy talking to them. It's going to really help us a lot and help us to be able to gain their attention and work with them to do all kinds of things that I would want them to do. We are coming to the end of this session for tonight. Once again, we want to appreciate our guests, Dr. Emmanuel Ojedeji. Thank you so much for making time out to join us. We are indeed very grateful. Thank you so much. And we hope that this will go to add value to parents and in turn help us to raise our children properly, help us to raise our children for God. This series is going to continue next week. It is a series, and we add next week, Thursday and Friday. We're going to Friday and Saturday, please. Friday and Saturday, 7 p.m. We're going to be having very powerful sessions. We're going to be having one on speech, and we're going to be hosting a speech pathologist. As well, we are going to be having another one on autism. Please don't miss any of those 2 sessions. If you are raising children presently or hoping to raise children at any time in the future, knowledge is very key and very powerful. Please don't miss any of the sessions because they are going to be very powerful one. This program has been organized by Faith Ministry, and we have the assignment of raising children for God. And all this we are doing, underlining, is that the parents to be child caregivers are equipped to raise their children for God in this generation. Thank you so much, everyone. Lastly, please do well to spread the good news of this program. Yes, please do well to spread the good news. Do well to tell your friends about it, and let's come together to have a very great time. Next time we're meeting, to have a very great time and to be able to learn as well as parents to be, and as child caregivers. At this point, we will call it an evening. Please have a blessed evening, and our warm regards to all God's heritage in our care. Good evening, everyone.
Yeah, good evening, Mr. Emmanuel. Thank you.